I am Kwame Boaitey, a pharmacist and a public health consultant. My area of interest is in antibiotic resistance, drug use or drug utilization, access to medicines. And so I've practiced in several different areas of pharmacy, and I've consulted for both local and international organizations in the area of antibiotic use and drug resistance. Well, as I just mentioned, AMR is just the acronym for antimicrobial resistance. And this occurs when viruses, bacteria, fungal, parasites, and all the germs we know changes form such that the medicines we use currently to manage them no longer become effective in the management of infections caused by these bacteria, fungal, and these organisms that we talk about. So essentially, that's what AMR is. Antimicrobial resistance is a huge problem, and this has been identified both locally and globally. For example, almost 700,000 people die of drug-resistant infections according to the World Bank. And they have estimated that in 2050, over 10 million infections or over 10 million people are going to die from drug-resistant infections. And this is going to be a very huge problem, especially for low and middle-income countries, where Ghana is part of it. Let me break it down. For example, if you're going to deliver in the hospital and you need cesarean section, in most of the cases, you will need antibiotics for this procedure. If you are going to do hip replacement therapy, if you are on cancer chemotherapy and other infections that needs to be managed with antibiotics, these drugs or these organisms are currently becoming resistant. And so all these procedures, for example, you have a wound that needs to be managed with an antibiotics, are going to be very, very difficult to manage. Look at COVID. We have all struggled with COVID to get drugs to manage COVID-19 infections. This is what is going to happen with antimicrobial resistance in the not too distant future, where we will not have vaccines for these infections and we will not have any drug to manage. So simple infections that we could manage now will become so difficult to manage very soon. And so this is why antimicrobial resistance is a very big problem. Think about how you can manage antimicrobial resistant infections. First, let's think about what causes antimicrobial resistance. See, organisms are so smart that once you expose them to the drug, they change form. And at some point, the drug can no longer manage it. And so overuse and misuse of these medicines are the major problem that drives antimicrobial resistance. And again, because we are in COVID era, I would like to draw your attention back again to COVID, where now we have variants in South Africa and the UK, where they are worried that the vaccines they have now can no longer manage. And so this is the situation with antimicrobial resistance. The more we use the drug, we just go to the pharmacy or we go to any over-the-counter medicine stores and go and buy it and use it anyhow. Doctors prescribe without confirming the infections. As we use this over and over again, the problems keep getting bigger and we can no longer manage it. So to deal with antimicrobial resistance, what we need to do first is to be able to limit the use of current existing antibiotics, which is very critical in helping us to manage the infections. And so the less we expose the organisms to the drug, the more we're able to sustain the lifespan of these antibiotics. Yes, I would say so, but I can't really say this offhand. But I would say that there are several different infections that are caused by a specific bacteria that are so difficult to manage. For example, now we have drug-resistant tuberculosis. We have infections caused by MRSA, which is multi-drug resistance or methicillin-resistant Staphylococcus aureus. And these organisms are very, very difficult to manage when they cause specific infections. And so I'll leave TB and MRSA infections with you. There are several others that almost in 90% of the cases, you can't really manage anything because the drugs are no longer effective and there are no new drugs to manage such infections. They are the two most common, but there are several others. For example, even gonorrhea now, it's so difficult to manage in several different countries because the available drug can no longer be able to manage these infections. Let me draw your attention to, for example, malaria in Ghana. We used to have chloroquine for the management of malaria, and now we can no longer use chloroquine. We have to use artesunate amodiaquine and artemethyl lumefantrine because chloroquine can no longer kill malaria-causing microorganisms. And so these are some of the examples that we can actually point out at the moment. I think every one of us has a role to play in managing antibiotic resistance. Doctors have a bigger role to play in that in most cases in several different hospitals, doctors prescribe antibiotics and antimicrobials for patients, sometimes without really looking at the specific organisms. And so we treat blindly or we prescribe anyhow for these patients. In most cases, yes, the patients, according to the doctor, may need the medicine. But if you go in and try to do culture to confirm the organism, you realize that you have probably been managing the wrong organism or you are giving the wrong antibiotics to this patient. And so if this continues, and like I said earlier, these organisms get exposed to the drug and they develop the resistance. And so the role doctors have is to look critically at which organism is causing this bacterial infection. Do these patients really need antibiotics before they prescribe for these patients? Patients themselves really need to also question why they are being given antibiotics. For example, there are several different upper respiratory tract infections, especially cough, some infections that you have, cough, cold, that do not need antibiotics, but you find that in so many different primary healthcare departments, antibiotics are prescribed for these patients. And so doctors should be very much careful when it comes to infections like this and follow treatment guidelines for the management of infections. And we believe that if this is done, we can limit the number of exposure of antibiotics to these bacteria, and that can help us in solving antibiotic resistance. This is a very important question. Investment in developing new therapy or new drugs are very important. For example, to again send you back to COVID, look at how much the UK government gave to AstraZeneca and Oxford University to develop COVID vaccine. So the monies were given to them to do this, and now the vaccines have come and everyone is using it. Problem is that so many different pharmaceutical companies are not finding investment in antibiotics profitable. And they are also worried that when this drug comes, we would use it inefficiently and then there will be resistance. So the drug that they have spent millions of dollars to develop now becomes resistant and the drug is no longer useful and no one is purchasing it. And so they can't reap the investment or they can't get the benefit or return on investment that they have. And so it's become a problem for most pharmaceutical companies. And so very few are now investing in trying to find new antibiotics. And again, let's ask ourselves, which people are very much affected by these infections? Low and middle income countries are the major places where you have a lot of infections. And we don't even have these pharmaceutical companies here. And so the big giants that can do this, they focus on current problems. For example, cancer, diabetes, hypertensive medicines that patient can be on for a very long time, and probably there are no resistance to these drugs. And so because there's no profit in the investment of antibiotic manufacturing, that is why most companies are not really investing in this. I would say that currently there are not so many different medicines that are available. But when it comes to specific infections, I have come across and I've seen colleagues talk about certain products that I think we can talk about at the moment. When it comes to the management of diabetic wounds, Buruli ulcer, and several different infections related to wounds, I would say that I've come across some aerosol spray and other products, but they are all antibiotic based and they compound the problem of antibiotic resistance. I have heard of Patylene, which is, I believe, is an effective product for the management of infections and wounds. I would say that by the mechanism of action, this is something that is worth exploring in the healthcare system because there are so many patients who have already benefited from such a product. And so because of the mechanism of action, which is not antibiotic based, I think it's very useful to explore these medicines in the healthcare system. As a public health consultant, for me, any product that does not compound antibiotic resistance, I would recommend it and I'll go for it. And Partholin is one of such products. And so I would recommend the use of Partholin in our healthcare system. If the NHIS can take it up, and if other institutions, for example, Borreliosa programs can take it up, it's something that I would recommend.